They're away.
Recording? Okay. So you tell me when you're ready.
We're ready.
All right. So thank you all for coming. My name is Andre. I'm a pharmacist here in the pharmacy residency program here at Sarasota Memorial Hospital. Thank you for those tuning in on Facebook Live, and thank you to all of you for coming today. So the big question that we have today is with drug information. Should you trust drug information on the internet? So kind of by the end of this presentation, I'm hoping to help you understand how much of that information you find on the internet is unregulated. I'm going to identify some key questions you can ask yourself when you're looking at these different internet resources to kind of help better understand which is reliable and which is not. And then I'm going to show you and demonstrate how to find some of these go-to resources that I recommend. So before we kind of dive into things, we have to understand what is drug information. By definition, it's the discovery, the use, and the management of information in the use of medications. Okay? And so when we're looking about drug information, it can cover anything from identification of the medications, to the cost of medications, to how your body interacts with that drug, to the different types of dosing of the medication, and also kind of the side effects of those medications. And so we take that information and we relate it to the individual patient's health. What are the patient's disease states and illnesses, and how can we combine this information with the patient to really benefit utilizing this drug information for the patient. So drug information definitely impacts my decision every day as a pharmacist. It impacts several healthcare providers' decisions, and it also impacts your own decisions when you're looking at drug information at home. And now the internet is such a great, remarkable source of information. You can Google search almost anything and find the answer almost instantly. Now the Institute of Medicine has something to say about that. So they say that the internet is a bit like the Wild West. It has vast amounts of unregulated territory and no one in charge. And that's completely true. The internet is very convenient, it's very interactive, and a lot of times it's usually free. Now what you choose to do with that information is up to you, but because there's so much information, it can kind of be difficult to judge what's reliable and what's not. Am I right? So drug information, here's a kind of a quick poll to kind of see where everyone else stands. Do you use Wikipedia as a resource for finding drug information? And so just by a show of hands, anyone always use Wikipedia for drug information? No, that's good. How about sometimes using Wikipedia as a resource? Okay, sometimes. And what about never? Okay, great. So we got one hand that says never using Wikipedia as a drug resource. So Wikipedia, as you know, if you've done a couple Google searches, you'll see that Wikipedia kind of is all the way at the very top. And it's because of that you kind of question, well, is Wikipedia a reliable use of information? Is it up to date? Is it accurate? According to an article published by the New England Journal of Medicine, it was titled Drug Safety in the Digital Age. Wikipedia actually may not be the most reliable thing to look at. And so here's an example where there were 22 FDA drug safety updates on different drugs, and Google searches on the day of the announcement increased by 82%. So that means that on a normal day, 82% of that population spiked up the search results of Google. Wikipedia increased 175% of the drug searches. Now that's incredible. That kind of gives you an idea of how many people are using Google, are using Wikipedia, just to find out about drug information. And so this article in the New England Journal of Medicine showed that 41% of Wikipedia pages weren't even updated by then. So essentially you're looking at that information, but it's already out of date. And they found that really no one's going to update that for a period of 2 weeks. So in that regard, Wikipedia is not always the most reliable. It's very limited in that, users can edit that information themselves. Sometimes it can be misleading to patients, even to healthcare professionals. So we really discourage the use of websites like Wikipedia. So these are kind of key questions you can ask yourself when you're looking at different internet resources. This will help you filter out, which information is reliable and which is not. So ask yourself every time, who runs that website? You can usually find this in the About Us section, but this is important because you want to look at the funding. That's important to note. If the funding is, from a commercial organization, you can kind of suspect some bias towards that. So ask yourself the question, what's the purpose of the website? All websites should really be for educational purposes. Now, if you're looking at the website and you're thinking maybe it's sales-based, or is there a financial gain for them? Again, that may not be the most reliable source. Third question you can ask yourself is, who's responsible for that information? You can kind of use this trick as a tool. Look at the suffix of the website. If it ends in .gov, that means it's sponsored by a government agency. Now, if it ends in .edu, that means it's sponsored by an educational institution. If it's sponsored by, or if it ends in .org, that again is provided by a nonprofit organization. But when you kind of see .com, those are more of your commercial organizations. So again, use it as a tool, but don't use it solely as just because it's .edu, it's completely reliable. So we need to look at how that information is documented. If you go on any website, you should always be able to locate the references. The references are usually found at the very bottom of the website, and that gives you an idea of where did this information come from. Did it just come from, me thinking this up on the fly, or is this documented evidence from, years ago or different trials? So that's always important to consider. Next thing you want to look at are what are the credentials of the contributors or reviewers? Are they healthcare professionals? Are they experts in that specialty? Or are they just, John Doe with no really credentials at all, and he's just really posting a blog post or something like that? So the contributors are always important to look at in their credentials. Something that kind of gets mislooked sometimes is the information current? You can have reliable information, but if it was from the 1950s, it may have been updated since then. So sometimes you can find the date under the title, look for the author. That's where you're going to see what year this was published. So always kind of be on the lookout to find the last published date. And the last thing you can sort of look at is that contact information available? With any website, you should be able to find somewhere where you can contact the owner of the website. Now, if the owner is based on a pharmaceutical company, again, you might think it could be a little bit biased versus if this website was owned by, for example, Sarasota Memorial. So I'd like to leave you with this quote. The challenge is not to find information, but rather to find information that is helpful to you. And now we kind of dive into these different websites that I think are great for patients. The first one is DailyMed. It's sponsored by the National Library of Medicine, and it's the official provider of all FDA label information. So some of you may know them as package inserts. They contain a lot of helpful drug information about the drug. And you can search by the drug name. You can search by its NDC code, which is National Drug Code. It's sort of this universal code for every drug, prescription, and over-the-counter product. And so let's say, for example, we search the drug amlodipine, a common blood pressure medication. What you'll find are all the results of that medication. Now, they can be from different manufacturers. It can be combinations of that pill and another pill. They'll list the national drug code there for you. And some of them will have even pictures of them. And so let's say, for example, if we go ahead and click the top, it's going to bring us to a more detailed drug information. At the very top, you can download a PDF or even print label information. And over here, you can kind of see the different sections. If you click on the plus, which will expand more information, for example, here we're looking at the indications and use of it. So amlodipine can be used for hypertension, for example. But it can also be used for other diseases. If you scroll down to the bottom, you can see this view all sections. And instead of pressing each of those pluses individually, it'll expand all of them. So it's a great overall information site for the drugs of all the marketed drugs from the FDA. And they're all up to date. So in addition to just drug information, you can also look at the identification using this box over here, the tablet capsule ID tool. So let's say you're walking around and you might have dropped one of your pills or multiple pills, and you have no idea which one it goes back to. But you know you need to be compliant with your medications, right? So using this identification, you can search by, sometimes you see the little letters or numbers on a pill. So you can search by the imprint. You can search by the shape. Is it round? Is it square? Is it triangle? You can filter it even more, look at it by the color, the size. If it's a score tablet, that can be split. Or if you even know the name and you're looking if this is the actual drug. Ideally, you can ask a pharmacist who can identify these medications for you. But let's say you don't have the pharmacist right at your disposal. This is one way you can quickly identify the medication. So here, for example, you have metformin, and there are different strengths of metformin, so sometimes they can differ. There are different manufacturers, but it'll give you a picture so you can kind of compare and make sure that's the right pill. So one of my favorite websites is called MEDLINE Plus. It's really great for families, friends, patients. It covers more than just drug information. So it covers natural and herbal supplements. It talks about different health diseases, and it also has a section for videos and tools. So say you want to learn about, how high blood pressure develops, or say you want to learn about a procedure that you might be going for. You can go to this website and you can view real-time videos and explanations of all of those processes. And let's say, you have a friend or family, they don't quite speak or read English. They have multiple health languages too, in addition to that. So if we go into the drug and supplement section, you'll be presented with this screen. Drugs are at the top. You can browse either by brand or generic names if you don't know both. Herbs and supplements also have a section. For example, if we go and select a drug in the L section, you'll be presented with all the different drugs. I just went ahead and picked a common thyroid medication. So here is what you'll see. So levothyroxine, it gives you two boxes. The top boxes are going to have a lot of frequently asked questions that you might have about the medication itself. In the red box are usually drug safety warnings. So in this case, it's giving an important warning that thyroid hormone should not be used to treat obesity in patients with normal thyroid function. That's really not what it's being used for. So if we click some of these frequently asked questions, it'll bring you into a more in-depth description. And something that's really great about MEDLINE Plus is that it uses easy language that anyone can really understand. So why is this medication prescribed? Levothyroxine, a thyroid hormone, is used to treat hypothyroidism, a condition where the thyroid gland does not produce enough thyroid hormone. So very simple, very easy to understand. How should this medication be used? Comes as a tablet and a capsule to take by mouth, usually taken once a day on an empty stomach, 1/2 to 1 hour before breakfast. So very clear instructions also. So this is a great site for that. So kind of moving on to the next. This website is called GoodRx. It can be a site that pulls in information from over 70,000 major US pharmacies. And essentially what it is it can compare drug information prices. So say you type in a drug, atorvastatin, a popular cholesterol medication, you can kind of see the different prices that are presented. And what this website does is it provides coupons and discounts and saving tips for how can you save on these medications. Now, in no way am I encouraging to go shop at different pharmacies. Where's the best price of this drug and where's the best price of that drug? That's not always the safest thing to do. But sometimes in certain circumstances where you really need this medication or you can't afford it because of your insurance, or maybe you lost that medication and your insurance won't pay for until the next refill, this website can be utilized. And always be sure to kind of let your other pharmacists know if you are happening to be picking up your other prescription from other pharmacies. So for example, if you look at the CVS Inside Target, there's a coupon for $15.81. You can click the Get Free coupon, and it'll bring you with this clip out. You can either text it to your phone, you can email it to yourself, you can print it out. This box is all the information that the pharmacy needs. It almost treat it like an insurance card. Even if you have insurance, you can still present this and they'll give you the lower price. So this is just one way to kind of check about prices. When I used to work in the retail setting, I would have patients come in all the time asking, how much is this medication? How much is this medication? So this is a really good reference if you're trying to get an idea, at least.
One problem.
Go ahead, Amy. One problem.
One problem with the coupons, it generally excludes federally funded insurance aid programs, and that is Medicare. Therefore, so Medicare patients that have the Part D insurance cannot take advantage of most, if not all of those.
That is one thing, that's a big thing too, is those insured with Medicare cannot use the GoodRx discounts,
Any
unfortunately.
coupons, and that's from a federal.
And that is from a federal standpoint, really.
Isn't that related to the income you have?
Not for these coupons, no.
Even though you're a Medicaid, but you have an income which is lower,
Right.
you can still use this?
No.
Just because you're enrolled in a federally funded program, it kicks you out.
No, actually, some of these coupons, like manufactured coupons, you can COB it with the actual insurances, like regular,
Yeah, and you have private insurance.
Yeah, you can
That's
see
different
it.
than a federally funded insurance.
Yeah, you
You
can
have private insurance, yes.
Yeah, you can, for the federal.
And so that's just another thing to consider. Though the website is great, there is that. But also there's no really obligations or fees associated with it. And so it's really just for your benefit. If you can use it,
Yeah.
then it would be
Right.
great. Mhm. So WebMD is another website that comes up a lot. It, along with Wikipedia, is reported one of the most frequent uses of finding health information and drug information. But the question sometimes I get, is it a reliable source? So if you kind of look at WebMD right now, the idea is that it does look like a trustworthy website. I see it a lot. But something that some people don't always see is that there are commercial advertisements. So if you look on just the front page, and I didn't even have to search for it, they have these passive promotion techniques. For example, do you have osteoarthritis knee pain? A different treatment option may help. If you click that Learn More, it'll bring you to, of course, this product that they're trying to get you to buy. So Synvis 1 is what they're promoting. And WebMD uses these television commercials and advertisements to kind of profit from. Another advertisement on that front page was for the drug company Afinitor. which is selling everolimus tablets for the treatment of metastatic breast cancer. So while WebMD seems like a trustworthy professional website, really these days anyone can develop a professional website in just a matter of hours. So that is just something to consider. Again, with that question of who is developing this website? Is it commercially based or is it from a nonprofit? So Google is a friend to many. All of us use it at least some point in our life. Let's say, for example, it's that time of year again, flu season, which it just so happens to be flu season, and you're not too fond of shots, but at the same time, you don't want to get the flu because you've got a marathon to run in the middle of December. So what are you going to do? Of course, you go to Google, you type in how to prevent getting the flu without a flu shot. So Google has a method where it brings up this very easy, concise to read white box that seems to fill in your knowledge gaps. If you look a little closer, not all the information is always complete or true. Clean your hands for 15 seconds. Soap, warm water, and a period of vigorous rubbing will wash viruses down the drain. So while it's true that this is a way to prevent the flu, it may not be the answer you're looking for as far as preventing to get the flu. And of course, WebMD happens to show up as the first search result too. So that is just something to consider.
It's disappointing the way they wrote how to dodge the flu without a shot. Very tempting.
And it is very tempting. These answers, they look great. They're easy. They're right there. They're answering my question that I had. That's exactly what they want you to think. And that's why they leave the ... until you click on the website. They benefit from that. They make a profit from you looking at their information. And that's why we have to have presentations like this. So these are summary of some of those drug information resources that I did go over. So DailyMed, again, it's the official provider of the FDA. It has all of the most up-to-date marketed drugs of the U.S. on that website. Another addition is having that pill identification. MEDLINE Plus, very great for almost anyone. Language in a very easy way to understand. Also has medical videos, and it has links to latest treatment options for maybe a medical condition that you might have. The CDC is not mentioned, but I included it in the information. The Center for Disease and Control, they have great resources for all vaccines. Now vaccines can be very confusing. There's a lot of misleading information out there, but the CDC always has the most up-to-date travel and health alerts along with vaccine information and schedules you can print out and see, okay, I'm missing this vaccine. GoodRx, again, is that database that compares different prices and provides discounts and savings from all the major pharmacies in the U.S. Again, the disadvantage is that federally funded programs like Medicare are kind of exempt from that. These are sort of additional websites that I did not touch on, but definitely wanted to include. Drugs.com is a great database. It comes from 4 different independent educational suppliers, even like Harvard. Talks about prescription drugs, over-the-counter, natural products. It has an interaction checker, just like the DailyMed. The FDA, Food and Drug Administration, that's where you'll find all new medications that have been released. That's where you'll find any drugs that have been recalled. And that's where you'll also find something called the Orange Book, which shows you different types of equivalent generic products and their substitutions. And another website I found is LACMed, also powered by the National Library of Medicine. Provides info on drugs and chemicals for breastfeeding mothers, so a great resources for nursing mothers. It has info on the side effects and the nursing infant too. And so nowadays, we've kind of become more of an innovative type of world. You can have all this information in the palm of your hands with mobile drug information resources. Most of us now have smartphones. All of these apps are free. GoodRx you can find mobile instead of hogging it around your computer. You can check these while you're in the pharmacy. Drugs.com you can have right at the touch of your palm. CDC, you can check your vaccine schedules. Lactamed, again, that education for nursing mothers. And a great one called About Herbs kind of touches on all of those over-the-counters and herbal products right at your fingertips. So kind of these key things that I hope you take away. Information obtained from the internet should always be critically evaluated. Ask yourself those questions. In general, most of the trustworthy sites are from government and academic sites. You always want to encourage yourself to talk to other healthcare providers and not always just rely on the information you find on the internet. And lastly, you want to be aware that not all information is reliable, but it should really enhance rather than replace that patient-healthcare provider relationship like I was talking with you about earlier. And so I hope this presentation at least kind of puts you in the right direction. I know drug information is a lot, and sometimes we can be misled by the information out there, but hopefully this presentation has at least given you some advantages as far as finding where to go. And now I'll kind of take any questions if you have any. Sure.
So let's say you do tend to shop around pharmacies, so you get some medication at one and some medication at the other. If you realize that maybe it's ideal to get all of your medications at one pharmacy, but you do have this struggle with income, is that something you could ever ask the pharmacist, like, hey, I've been using this other pharmacy, are there any maybe grants or discounts that I'm overlooking at this pharmacy? Is that something that pharmacists can ever discuss?
So the question was, what if I have most of my prescriptions at one pharmacy and, due to either income or some issues that I can't get my other medication at this other pharmacy, I have to kind of reach out and look at another pharmacy to get that prescription. And she was asking, well, does the other pharmacy have anything as far as grants or discounts that can kind of prevent me from going to both pharmacies at once? And the answer to that can be, it depends. A lot of times if you go to that second pharmacy where maybe your insurance or maybe the coupon didn't work at the previous pharmacy and this other pharmacy offers a more easier price for you, you can talk to your original pharmacy where you pick up most of your medications. Let them know the issue. Hey, I really like picking up my medications from you, and I really want to keep all my pharmacy medications here, but my insurance isn't allowing me to get this medication for an okay price for me, so I have to go over here. If you talk to your pharmacist about that, a lot of times they can find out if there are patient assistance programs or if there are manufacturer coupons that can, give you that similar price that made you, oh, well, I have to go to that pharmacy to pick it up. So it can be just a simple discussion with that pharmacist. Who is your pharmacist? And really, you try to limit that to one.
So in some of the free clinics, they give for $4, but they only prescribe number of drugs.
Sure.
For hypertension, for diabetes.
Okay.
Yes.
So he was bringing up that at certain pharmacy, there's a $4 list, or even some pharmacies provide certain medications completely free. And again, that is more of a marketing ploy. Certain pharmacies, offer free antibiotics or free blood pressure medications. Because the idea is really, well, if those prescriptions are free and I'm on that prescription, then let me just come and fill my prescriptions there. And so that is, again, everything comes back to marketing and how can I benefit and profit the most, but also how can I get the most customers.
The pharmacists are doing a great job because, as I say, wherever you go now, they got a consultation and they
Sure,
are willing to talk to you So if you have a good rapport with the same pharmacies, matter of $1, $2, they will say this is expensive, I can recommend something else.
And I think still, pharmacists are the most accessible, healthcare providers out there. Sometimes doctor appointments take hours to wait for, or they're so difficult to schedule, but the pharmacist is always around that corner, and they always have that consultation window for, any type of problems. And sometimes it'll save you a doctor visit. And sometimes if it's a price issue, you can work with the pharmacist to kind of, get that price down a little bit or work out whatever's best for you. Because everything is always in the best interest of the patient, is how we see it all the time. And even again back to the antibiotics and other medications that are sometimes free, sometimes that helps, those of us who are less fortunate, those who are kind of in the indigent populations, don't have insurance, can't afford their medications. Those pharmacies at least can make that possible for them to get at least some of those chronic medications filled.
Nowadays, pharmacies are also doing the printouts. But when you read this printout, I don't know who reads it. But if you're taking 6 medications, there are 6 printouts.
Sure.
Okay, and there are very standard, same precaution, contraindication, reactions. They're in fine print. It's hard for the elderly people to read.
Right, and so he was bringing up the issue that even though I'm picking up my medications, I may have 6 different medications, and I'm getting all these different handouts. Am I really going to read all of these handouts? I have a ton of questions. There's a lot of side effects and contraindications that, I'm getting overloaded at times. And, maybe at home when I finally decide to take a look at it, I have no way of interpreting it. And so, really by law, a lot of the pharmacies that dispense medications include those package inserts. That website I showed you, DailyMed, has those labeling information there that you can find. And that's why it's so important to, if you have questions about your medications, you talk to your pharmacist about them. Whether you're checking out or even if you've been picking up the same medication for 2 years and now you have a question, always feel free. A pharmacist is always going to be there to answer your questions. And when you don't have them, you have your reliable drug information sources to give you an idea too. Yes?
So if someone does use multiple pharmacies, there's no way for the pharmacist to look up there's no way, if I use 2 pharmacies, for you to be able to see what I'm getting at the other pharmacy. Is that correct?
Right. So the concern that was brought is that if I'm in one pharmacy, is there any way for me to look up that a patient is buying prescriptions from another pharmacy? And really the answer is it can be very difficult to figure that out. A lot of times, we don't encourage anyone to really go polypharmacy because then it becomes a safety issue. Are they picking up this blood pressure medication here and this blood pressure medication here, and now they're on too much blood pressure medication? So the idea is, communication between both pharmacies, if that's the case, or really between the patient and the pharmacist, which was why I was really encouraging and making sure that if you are filling at another pharmacy, always make sure to let your pharmacist know. Luckily here in the hospital, we're able to obtain that information a little more easier, but that's not always the case out there in the community setting.
So then it's probably really important to carry around a medication list, an updated one, if you do have multiple
Definitely.
medications, and maybe review it when you do pick up
And
new
so
ones.
having a medication list is something that we are always looking for. No matter if you're going to be admitted to the hospital, having that medication list and having a date on it so that we know when this was last updated gives us an idea of what are your home medications. So in the hospital setting at least, we can reorder those important home medications while you're here. Or if they are going to different pharmacies, they can present the pharmacist with their home medication list, and the pharmacist can then check, okay, I'm not going to fill this medication because it looks like you're getting this medication already from a different pharmacy. So that is definitely something that we always encourage our patients to do, is to carry around an updated medication list at all times. That way, anytime you're admitted to a hospital or you know, even if you're seeing your primary care provider, you have that access. Because medications play a huge role in your care, and we always want to make sure we have the most up-to-date information.
Do you happen to know if any of those apps that you showed, do any of those have a spot to put your own personal information, or are they just research-based?
So most of these mobile apps, at least, do not have a place for their medications. There probably is My Medlist. Oh, actually, I was incorrect. So drugs.com actually does have a My Meds list.
Great.
But there's so many different apps out there, you've got to find the one that works best for you. And kind of once you find that one or two, or three even, and I would really limit it to that, so you're not overloaded, you can use those apps and really get familiar with them. A lot of times, you know, updating can be a hassle, especially if you're changing medications all the times. So physical copies are not always the easiest. And now with the help of, you know, smartphones and technology, we have access to easily update things now, you know, virtually. So that is a good catch right there. Drugs.com does have a My Med list that you can update.
Whatever it is, I think we have lost the human touch. That's the main thing.
That can be one benefit of using the same pharmacy too, because a lot of them now have online where you can do some of your stuff online and it would list all the medications you're getting from them.
Right. So two great points. One is, you know, you can never really lose the human touch, meaning, you know, we're not always just treating the patient based on what their labs and what their numbers are looking at, but, you know, just touching and seeing and how are they physically doing is always what's most important. And another person had said that nowadays most pharmacies have, you know, their own pharmacy app where you can look at your medications right on your phone. You can see when you need to get it refilled. You can even nowadays scan your phone and then get your medications. It's as easy as that.
If you go to the same pharmacist, if you live in a small community, Tim knows me, Kathy knows me. Okay, Krishna, come in. So they have a record and all there. They also have a little more time to spend to talk to you. Unlike the physician. In fact, it's the physician's duty to explain the side effects. But the business aspect, there's a very interesting book called American Sickness by Kathleen Rosenthal. She has given the whole history of the insurances, every aspect. And the patient should ask, what is consumed, what is the crime. So really, how the insurance disability started from there back in the 1870s, and how it's become. She was the emergency room in the New York Times journalist in the past. She has written a very good book, American Sickness. It was on PBS.
So again, that's why it's so important to really, you know, have yourself one pharmacy. You know, you start to develop that relationship between all the different staff, the technicians, the pharmacists. They know you and they know your health now. Then, you know, as a result, they take better care of you, and your care is, you know, at their attention all the time. Versus if you're going to multiple pharmacies, you know, no one really knows you. No one really knows what you're taking. So that's important too. All right, thank you all for coming.